Magandang umaga po sa inyong lahat and welcome to another pre-recorded video lecture for the subject NCM 107, Care of the Mother, the Child, and the Adolescent, and this is the Concepts in Pediatrics. I am Dr. Jeffrey Reboron, and this session we will be learning about breastfeeding, the importance of breastfeeding, the different breastfeeding cues, the different breastfeeding attachments, the different breastfeeding positions or breastfeeding holds, and the difference between cow's milk and the breast milk. And we will also be talking about eye prophylaxis or what we call CRIDS prophylaxis. So please bring out your handouts so that we can facilitate our discussion for this session. Let us talk about breastfeeding. So what is the importance of breastfeeding? According to research, breastfeeding is known to increase the chances of survival of a newborn by 13%. So it improves the survivability of a newborn when they are already breastfeeding.
Now, always remember that meron silang sinasabi na yung mga batang nag-50-50 daw, okay, after delivery. Now, that is basically correct. Okay? There are some patients who are delivered, especially yung mga newborns natin, that they become in danger after delivery. But, according to research, when you breastfeed these children immediately after birth, what happens is we increase their chances of survivability by 13%. So hindi sila nag-50-50, nagiging 63-37 po yung chances of survival. So again, breastfeeding is very important because it increases their chances of survival. Bakit kaya? Marami pong rason kung bakit napakaganda yung mga breastfeeding sa ating mga newborn patients, and you will learn about them later on. Okay, sabi dito, a newborn is believed to be ready to be breastfed 20 to 30 minutes or even up to 120 minutes after delivery. So basically, that's 1 minute to almost 2 hours. Tama po ba? Okay, after delivery. So ibig sabihin, sa mga time na yon, after 20 to 30 minutes, ready na daw mag-breastfeed yung bata. That means to say that you have ample opportunity to open the airway, to thermoregulate the newborn, to properly time the cord clamping. So nagagawa mo na ito lahat-lahat bago pa magutom si baby. Alright? So after 20 to 30 minutes of thermoregulation, maintaining a patent airway, and clamping the cord, pag natapos mo yan, sakto, magugutom na si baby. So you can already start breastfeeding 20 to 30 minutes after delivery, or sometimes it can even extend up to 120 minutes after delivery. So yun po yung window of hunger ng bata. Okay? Now, always remember that during the delivery po, after delivery, I should say, when the mother is still inside the delivery room, yung bata po, we place them automatically on the chest of the mother, on the abdomen of the mother. Okay? So, habang hinihintay po yung breastfeeding cues, so papamagaan tayo dejo ubingan, checkin tayo dejo patent airway kada iklakam tayo di korden, sakto, malapit na po yung ulo ng bata doon sa source of breast milk. Okay? So, after 20 to 30 minutes, makikita na natin na magkakaroon na ng feeding cues yung bata, or bibigyan na niya kayo ng clue na siya ay nagugutom na. Alright? Now, while waiting for the feeding cues, ito yung mga signs natin para malaman natin kung gutom na yung bata. Alright? So, while waiting for the feeding cues, we should assess the newborn if they are breathing and if they are already warm. Now, like I said a while ago, habang hinihintay po natin yung feeding cues na ipakita ng newborn para malaman natin kung siya ay ready na to breastfeed, we should already start assessing if the newborn is breathing or if the newborn is warm. Alright? So, kastati itsura nati ag breastfeeding, it's very good for infants, newborns, and even the father. Charing. Okay, right. Now, ano yung dapat tinitignan natin ay like I said a while ago, during the time that you are waiting for the breastfeeding cues, is you have to listen for the grunting sound. So habang papamagaem dejo ubing, habang iururay mo nga agbisin you have to listen for the grunting sound. Dito kay dejo pinagangis na. Okay, dejo ubing. Denggem no dati garalgal na. Kung ganun ba mag-breathe yung bata. Because if the newborn breathes that way, that may mean that there is a problem when it comes to the respiration. Okay? You also look for chest indrawing and fast respiration. So, yung fast respiration, alam naman natin yun, di ba? If it's more than 60 cycles per minute, that is already considered fast breathing. Alright? More than 60. Now, paano naman yung chest indrawing? Pag sinabi natin chest indrawing, it is a sign of difficulty of breathing po. No, dayjay kumadeto yung ribs na dayjay ubing niya, no, agangis isuna, ag-rise and fall dayjay abdomen na. But what happens in chest indrawing is that no deto yung kumadayjay yan ti ribs na, okay, no, agangis isuna ke makunot deto yung agpauneg. Alright, I will send you a video of what chest indrawing looks like. So, no agangis na, tas nakunutin na dagajayan ti ribs na pay nga agpauneg. Alright? So, those are the signs of difficulty of breathing. Kung meron tayong grunting sound, merong chest indrawing, or may fast respiration, there is a problem when it comes to airway and respiration. So, isa yung tinitignan po natin while waiting for the feeding cues. Okay? Taano mo tayo, no, mabisin de ubingin, i-check tayo yung breathing. The next thing that you have to check is warmth. Okay? Like I said, it's also one of our responsibilities as a midwife to thermoregulate the newborn. So you check the temperature of the baby by using a thermometer. Or kung wala kayong thermometer available in the delivery room, or kunwari pinanganak nyo si mother in the emergency area or nasa tricycle or nasa bahay na pinanganak nyo, you just touch the sole of the foot. Okay? Rinain nyo lang di mukod di ubing. And if the newborn's foot is cold, that means that he or she is suffering from hypothermia. So what do? You always keep the baby in skin-to-skin contact. Mabaling nga you dry thoroughly the newborn, ulasam kaninanang na, and place the newborn or give the newborn drop light and blanket and bonnet. So those are the things that you can do to thermoregulate the newborn pag siya ay giniginaw, pag malamig po yung sole of your foot or kung mababa yung kanyang temperature. Alright. So the next thing, pag habang hindi pa nagugutom si newborn or hindi pa natin nakikita yung mga feeding cues, the next thing that we can do is we can do routine procedures like weighing. So, syempre, no, hampay mabisin di newborn, mabalin yung alain di nga gundawayen, taano, kitain, no? At asanusuna kadagsen. So, you weigh the newborn and then you also take the anthropometric measurements. Alright? So that the anthropometric measurements is the jurukudan nyo the giganti head circumference, chest circumference, abdominal circumference, total length, kung kunada. So yun yun. So pag nakuha nyo na yung dalawan yun at hindi pa gutom yung newborn, hindi pa siya nagpapakita ng signs of hunger, you can give them injection of vitamin K. Alright? So your vitamin K or your vitaminadione prevents bleeding. Alright? So, nya pa iti mabalintay nga ited, no hanlata mabisin, mabalintay pa nga iteden, dejay, naganadiyan, Hep B vaccine can BCG vaccine. Alright? But, if the newborn is breastfeeding, okay, if the newborn is breastfeeding immediately, hanyong ibagbaga nga sir, alaay mi nga rudin, deto'y ubingin, tamakilo, ma-AP measurement, hindi po pwede yon. Alright? So, you only do that after the full breastfeeding cycle is complete. No, di oneg ti delivery room, tarinugyan ko madedyo ubing ti agkunuten, ti breast milk nan, you do not stop the breastfeeding cycle if it has not yet been completed. So, padiretsuan nyo latan nga, pagkunutin ng ubingin, ingana mabmabsog, before you proceed to doing these procedures. Ngem no, you haven't seen those feeding cues yet, the next the thing that you can do is proceed to weighing, AP measurement, and vitamin K and other things like that. So I hope that is clear. Okay? Habang hinihintay po natin ang breastfeeding cues, pag hindi pa gutom yung bata, okay, pag hindi pa po gutom yung bata, you can start weighing, AP measurement, vitamin K, and vaccines. Ngem no, rugrug yan na tagsususon, you should not stop the breastfeeding cycle unless it is complete. Alright? Hamuhang nga na importante apo dagita pinag-weigh kada pinag AP measurement ngem dejay diretso nga pinag breastfeeding na. I hope that's clear. Okay? So that's how you take the temperature of the newborn. Alright. We also have the concept called latching on. Ano bang ibig pong sabihin when we talk about latching on? Ang term na po ito, it means that this is the breastfeeding procedure that is done while the mother is still inside the delivery room. Okay? Ito po yung tinatawag natin na early breastfeeding. So pag yung nakikita nyo sa picture, yung nanay po, nasa loob pa siya ng delivery, tinatanggal pa lang yung placenta, but the newborn is already breastfeeding. Ang tawag po dyan ay latching on or breastfeeding while the mother is still inside the delivery room. Maganda po ba to? Yes, may mga pros po ito, may mga positive effects po ito sa ating nanay at sa bata which you will get to learn later on. Alright. So meron din po tayong tinatawag na subsequent feeding or feeding by schedule. Alright? So it's good that you are familiarized with the different terms which are connected to breastfeeding para it's good that you are familiar with these kinds of terms so that when we talk about things like this inside the hospital, at least makarelate kayo. Okay? So, ang muyo tatanong niya ti kaya nasawen ti latching on, the next thing that we will learn is what subsequent or feeding by schedule means. Okay? So, pag sinabi na po nating subsequent feeding or feeding by schedule, this is a method of breastfeeding or feeding the newborn or infants every 2 to 3 hours. Okay? Detoy, hanta yung nga iura yan nga agbisin di ubing. Papadedyan tayo insigidan every 2 to 3 hours. That is what you call feeding by schedule. So if you look at the picture here right now, DJ pinagpasusunak is 2 a.m., 5:30 a.m., 6:30 a.m., diba? 8:50 a.m., 10:50 a.m. So that is what you call subsequent feeding. We do not wait for hunger signs or breastfeeding cues. Sabay tayo nga padedyan di newborn, pinapa-dededa natin siya every 2 to 3 hours. So subsequent feeding or feeding by schedule. Meron din tayong tinatawag na concept of demand feeding. Okay? Coming from the word demand. Okay? Kaya na. Okay. Kaya po, tigdeden ko na listen, sugar tits. When I say I'm hungry, that means I'm hungry now. Kuna na ubing picture. So when we talk about demand feeding, this is the breastfeeding the baby whenever the baby cries or shows breastfeeding cue. So dito po wala tayong sinusunod na schedule. Ang sinusunod lang po natin dito ay padedehin yung newborn pag siya ay umiiyak or padedehin yung newborn kung nakakakita tayo ng breastfeeding cue. Alright. So, magpapakita naman ng breastfeeding cues si newborn, wag po kayong mag-alala, and you will learn these different breastfeeding cues later on. Meron din tayong tinatawag na supplement feeding or supplementary feeding. Okay? Itong supplementary feeding naman, we only start this during the 6th month of life. Alright? So, ibig sabihin niyan, the newborn will not anymore be contented with breast milk alone or bottle milk alone hanga mabalinan nga puro gatas laeng ti ang kanin na medyo ubingin pag siya ay 6 months old na. Now, in your supplementary feeding, always remember po that the breast milk that the newborn is getting from the mother is low in the mineral called iron. Nababati iron na dejay. Okay, apaya. Di nga breast milk, awan talaga ti iron nga maala di jay. So, supplementary feeding or supplementary food is needed to prevent iron deficiency anemia. Tagamin na di ubing, hanta yung ikanti other sources of food na like kumadagita fruits, vegetables, nalusak-lusak nga saba, kadaam. Nuhan yung ikanti kas jay, 6 months na, 2 years old na, breast milk latta. Okay naman, pero magkakaroon siya ng iron deficiency anemia. Kasi nga wala pong iron yung breast milk. Alright? So, those are the terms related to breastfeeding. Next, ano ba yung mga breastfeeding cues natin? Paano natin po malalaman if the newborn or the infant is already hungry? No, damagin tayo kadagi dyan ng nanang DJ, tibagada, misis, kasano nga mamam no mabisinan DJ anak mo? Agsangit, sir. Tama naman sila? Tama. Pwedeng tama din sila, but that is already a late sign of hunger. Nalabesen tibisinan, dejay maladaga, dejay newborn, no, samla pa pakanin, suna no, agsangit. Alright? So, ano ba yung mga breastfeeding cues talaga na meron dapat natin tinitignan? Number one is there is eye movement under closed eyelids. Nung nakaidda, di ubing ko mga maturog, ag garaw-garaw di yan timatana. Okay, garaw-garaw di yan timatana. Ibig sabihin, that is a breastfeeding cue, may restlessness yung newborn, kaya ibig sabihin, siya ay nagugutom. Laglagipin nyo nga newborns can drink or eat even if they are asleep. Alright? So, kung makita yung garaw-garaw di yung mata na di ubingin, kung ayon misis, padadeemon deta, anak mo mabisinin. So, that's one breastfeeding cue. Eye movement under closed eyelids. Number two is we also have alertness. Movements or flailing of arms and legs. No, di ubing, garaw nga garaw. Okay? Garaw nga garaw di newborn, kaya nasawin deta is mabisin. Always remember that the newborn, especially on the first 28 days, deta ket mangmangan ken maturog lang tubraen na. Alright? Agreeing deta tano lang mangan. So ngano alert di ubing, no siririing di ubing, kaya nasawin deta mabisin. No garaw nga garaw di makensa ka na, kaya nasawin deta mabisin. So that's the time that you breastfeed the newborn. Ang asika mang breastfeed ay bagam kininanang. Okay, Mrs. Pasuswemon ko nang baka kay dirwar mo tasusumon madama duty papadedekan tumi di giant. Alright. If there is also tossing, turning, and wiggling, okay, dito dito, lang api nga gumarawan dito yung anak ko kung panada. Right? Ibig sabihin lang po nun, nagutom na yung newborn. Okay? There is also mouthing, agnganganga, licking, agdilpa-dilpa. Okay? Tonguing, sanasanap-sapen na dayjay dila na. That's what you call tonguing movement. Panakanana, alright? Those are breastfeeding cues. Rooting. Pag sinabi nating rooting, ito po yung reflex na if you touch the side of the cheek near the corner of the mouth, no sa gidem deto yung parte, sangwen ni newborn deta. Okay? Sangwen na deta. That's what you call rooting reflex. Pag tinatch mo ditong side na to, okay, dito sa cheek, sangwen ni newborn deta. Rooting reflex. Okay? Apay nga dati rooting reflex, tagamin the newborn's eyes cannot yet see. Alright? Kasi nung mabirukan di nipple because of the rooting reflex. No, isagid-sagid ni nanang deja yanti nipple, dito yanti cheeks na, the newborn will turn to that direction. So nga na insagid-sagid ni nanang deta nga nipple or deta nga imanan, sinango deja ubing nagkunot. Rooting reflex, ibig sabihin gutom na po yung bata. So, pwede na po siyang padadehin. Next, there is also change in facial expression. Okay, agkusi-kusilap, nagigrimace yung bata. Apin nga tangang kasla uncomfortable, kasla makasangsangitin, kasla irritable, deta rupa na. If there is a change in facial expression, then basically, yung bata po ay medyo nasasaid na siya sa gutom. Okay, dandanin, sangit data. Okay? Nurugyan nanti create this squeaking noises. Sa baboy ko mga baboy nga squeak. Okay? Kananan. Or light fussing. Okay? That means that the newborn's hunger is intensifying. Ngem, no hamo nga pinansin dagitoy nga early stages or early signs of breastfeeding hunger. It means na magpro-proceed siya sa crying. So pag iiyak yung bata, that goes to show that the newborn's hunger is already in the extremes. Crying is a late sign of hunger. So sabihin po natin sa mga magulang na hindi po tama yung hihintayin pa yung bata para umiyak bago natin sila padadehin. You have to teach the mothers, especially the first-time mothers, about these different breastfeeding cues so that they will not be dependent on the teachings of the older generation nga ibagada may sakada lang agpasuso dapat no agsangsangit di ubing. Dapat i-erase na po natin yung knowledge na yon. Alright? So I hope that the breastfeeding cues have been cleared up. So sana po ay clear na sa inyo yung mga palatandaan kung paano natin malalaman that the newborn is already hungry. So what is your problem? Kung ano ninanang no, I'm hungry. Kung ano na medyo ubing. Alright? So again, crying is the late sign of hunger. Now, how do we initiate breastfeeding? Especially sa mga first-time mothers po, mahirap po sa kanila ang mag-start ng breastfeeding cycle. Ado ti irasun dagidyanan nanang, especially dagidjay, handa kayat di ibagada nga agyudayo to dito susukon. Bagada to nga magsasag yung susuk kasi sutim bagada dagidjay kakabagyan minga nalpas nga nagsiksikugen, yak kayat nga agsag di jay, ang kukay agpasuso. So, mahihirapan sila kasi marami silang mga beliefs na naririnig, okay? Or judgment regarding the process of breastfeeding. Awon rumar sir nga tubog ti susuk, sir, bulsek de ti susuk kung kanada. Adu ti rason na. So, we have to assist the mother during the early stages of breastfeeding initiation. That is one of our midwifery responsibilities. So, again, paano ba natin siya isa-start dapat? Always remember that health workers should not touch the newborn unless there is a medical indication. Okay? Anong ibig sabihin nito? Nagsususulid yung ubingin. Okay? You do not need to touch them. You do not need to interrupt their feeding session. Okay? No agsususulaki di nga makita yo. But, if the newborn kunwari is amal, di yan tisusong yung nakita da nga may meron palang problema, meron palang kailangan na gawin. Like for example, the newborn had meconium staining, yung naamalan na may gisuso. That's the time that you can interrupt the breastfeeding for deep tracheal suctioning. So again, kung wala naman pong problema at nagsususo na or nagbe-breastfeed na yung bata, you do not interrupt the feeding session. Right? You have to remember that. Next, you also tell the parents that it is a no-no to give sugar water. At dagamin dagi do mga babakit, kada nananang nga kunada, painumem ti danum nga dati asukar na, tano napigsan to, tano nakired kunada. That's wrong. Okay? We do not give sugar water anymore. Ano pa? If the newborn is born in the hospital, hindi din po pwede ang formula milk or bottle milk. Medyo matemplang agatas like Promil, S26 kadaglalok. Hindi po pwede yon. Okay? And other pre-lacteals, yung mga gatas-gatas po dyan na nititimpla, hindi po pwede. Why? Because we are regulated by the law called Executive Order number 51 or EO 51. Okay? It regulates the use of milk and milk products in the hospital. So again, no makita tayo nga adda ti bote, ti gatas ti jay, we confiscate them. Right? We confiscate these bottles, these milk products that are given to the newborn. Bakit? Because as midwives, we have to be advocates of breastfeeding. So hanga mabalindag di rason nga, sir, deto gamin susuk ke bulsek, may mga workaround po tayo dyan. We can do several things to prevent that from happening or solve that problem. Right? So again, hindi po pwede, walang exemption po ang pagbibigay ng sugar water, formula, and other pre-lacteals. Lahat po dapat we encourage them to do breastfeeding. Right? So like I said, only breastfeeding is allowed because it is our responsibility as a midwife to become breastfeeding advocates. Next, it is also not good to give bottles, okay, or pacifiers, especially if they are still newborns, okay? Sir, kasano kimbagamit nga mabalinti pacifiers na gijay, lalo no infancy? Yes, infants pwede po. Pero during neonatal period, on the first 28 days, hindi pa po tayo nagbibigay ng mga oral stimulants. Dapat yung oral stimulant lamang niya ay ang suso ng nanay. Alright? Next. You also tell the parents to not throw away the colostrum. Okay? The colostrum, ito po yung first breast milk that is produced by the mother. There is a belief of older generations that colostrum is spoiled milk. na bangles nga gatas. So nga kuna dagiti lululang yo, kuno tem deta suso deta laka ay deta bake mo ta itupram kinabangles DJ nga gatas DJ puraw kunada. That's wrong. Alright? The colostrum is not spoiled milk. Kaya po ganun yung color ng colostrum, medyo nag-yellow pa siya or medyo nag-clear pa siya yung color. So, ano bang color ng gatas? Di ba? Puti. Okay? Kaya gaputa sa balit itsura na di colostrum, ibagada di bakit nga na bangles nga gatas dito. That is not correct. Bakit po? Because colostrum is very important to be eaten or drunk by the newborn because it contains immunoglobulins that protect the newborn. Dito yapo immunoglobulins are the same as your vaccines. Kasi na bakuna which will prevent common coughs and colds. Okay? Nagita ti maproteksyon na deta colostrum. So, napintas nga matilmon dapat dito di ubing kasi pampatangken ti kired. Pampalakas ng resistensya yung first breast milk of the mother, which is called colostrum. Alright? So it contains immunoglobulins that protect the newborn. Next, always remember that we let the baby feed for as long as he or she wants on both breasts. Okay? No, agsususulat ta, kaya't nalatatigdaddahan yung iba gani, nasubra amon tinanganan, hindi po. May mga automatic pong switch on and off yung mga bata. Alam po nila kung sila ay gutom pa or busog na. They will automatically stop. Okay? Breastfeeding or sucking if they are already full. Ngayon habang agdededepay lang deta kaya nasabi na hampay nga neck. Alright? So let the baby feed for as long as he or she wants. Aside from that, sinabi din dito, let the baby breastfeed on both breasts. Dapat duwa nga suso tipakunutan. Why? Because it will help relieve engorgement. Pag sinabi po nating engorgement, ito po yung sobrang paglaki ng suso dahil sa sobrang dami ng gatas na laman. Okay? Gaputan na gaduti karga na deta nga gatas deta nga suson, mabennat so na nga mabennat. Tinagan na deta kit engorgement. In Ilocano, we call that agdegges. Or in some dialects, it's agtegges kunada. Alright? Ag-overflow pa di yan ti gatasen, rumrumarapay ti dadu mga tubog ti susunan. Painful daw yon para sa mga magulang. Okay? Now, sir nga nagkakaroon ng engorgement kasi hindi natatanggalan ng laman yung suso. So, what do we do to relieve this feeling of engorgement, this feeling of discomfort? Pagsuswim di ubing on both breasts. Alright? So, sometimes, nagkakaroon din ng mastitis yung mga babae. When we say mastitis, it means infection of the breast. Alright? Infection or inflammation of the breast. Tapos ano nga mapaspasamak dito mastitis gamin? When there is engorgement, di ba? DJ susum kinaben natin, gaputa aduunay ti danum, tuloy. Aduunay ti gatas na. Okay? So gaputa aduunay ti gatas na DJ nga suso, tahami nga may kikatanin, pwedeng nagkakaroon po ng tearing doon sa mga nipple area, agsugat-sugat data, and that can also lead to infection. Alright? Iso nga, the only way that we can prevent engorgement and mastitis is to prevent yung paglaki ng suso because of lack of breastfeeding. Okay? So dapat pagsuspend tayo nga pagsuspend di ubing mapreventaran detoy engorgement and mastitis. Alright? So when the mother is initiating her breastfeeding, damo na palang tigpasuso, it is your responsibility as a midwife to help the mother and the baby in a comfortable position. Dapat dijay da komportable nga position at very enjoyable melaing the first experience na together as mother and child nga breastfeeding. Di ba nagmadimin nagpapasuso ka kumatapos ang hanapin na si position mo, matangan ka, there is a high chance that the mother will not want to breastfeed anymore. Kung nada, kaya itigpasuso, makatang ko na ganito. So it's your responsibility as a midwife to help them assume a comfortable position during breastfeeding. Aside from that, you also have to observe the newborn. Okay? Always observe the newborn no mapangkay vital signs, ti nanang kin medyo ubing, ikit kita yu medyo ubing. Alright? You look at the newborn, once the newborn shows signs of feeding cues, ask the mother to encourage the newborn to move towards the breast. No, agdilpa-dilpat na ubing yan nakikunamon, misis. Iya si deg mo deta susumon ka ni baby, tanurog yan ng tiag, kunot ti gatas. So that's what you use the breastfeeding cues for. Dahil ti pang-iusaran nyo dahil nga knowledge yo. Okay, so makita yung agpakita ti breastfeeding cues ti ubing, you encourage the mother to start breastfeeding. All right. We also have Republic Act 7600. Pag sinabi po nating RA 7600, ito po yung tinatawag natin na Rooming In and Breastfeeding Act of the Philippines. Okay? Page mo natatay, EO 51. Okay? Yung Executive Order 51, it prevents the use of bottle or formula milk inside the hospitals, and it also regulates other milk products in the country. Dito met RA 7600, ito po yung law na nagsasabi na hindi po pwedeng ma-separate yung bata at saka yung nanay when they are still inside the when they are still in the hospital. Dati-dati kasi, after the delivery of the mother, we immediately get the newborn and take them to the neonatal ICU. Pag sinain min, sa bali ti papanan na di ubing, sa bali ti papanan ni nanang mapantumit di obigay ni nga warden. Ngayon po, because of the Rooming In Breastfeeding Act of the Philippines or the RA 7600, hindi na po pwede yon. After delivery, the mother is moved into a stretcher with her baby and they are transported in their room. Anong ibig sabihin nito? The mother and the child will stay in one room. Apay gamin. Idi gamin apo kinarigat ti pasuswen dagijay nanang dagijay anak da, especially if they are in the NICU. Di kadi? Malagid pula unay when I was still a student, agayab kami idi, pamisunduan DJ kami NICU nga nakajutig, sang sangit ko medyo ubing, mapaminto pa lang dagdagasen ni nanang na, DJ yanti, obigay ni ward, nakabaybayag tupay laing kwamag na ni nanang na, santo, pasuspend na DJ ubing. So, sobrang kakaasi dagiti newborn CD. But now, that is not anymore a problem because the newborn stays already with the mother in their own room. Alright? So, non-separation po of the newborn and the mother ang sinasabi ng RA 7600. Alright. Sorry. Next. You also have to remember that positioning for the newborn during breastfeeding is also essential. Napaka-importante po na malaman natin as midwives kung ano yung proper position para po may advise natin ito sa mga nanay. Right? So always remember that the newborn's neck is not flexed or twisted during breastfeeding. Dapat, tenged di ubing ket nga nakakasta. Ang nakakasta, nagpapasuso dapat diretso laing po, it is not flexed. Alright? So makita yung tengid na nakaposition na siya at apay. Nung nakakasta po narigating tilmo, nung nakakasta narigrigat mo ng tiag, tilmunen. Alright? So the newborn's neck should not be flexed or not twisted during breastfeeding. Next, the newborn should also be facing the breast. Nakasanguso na dapat ti suso nga kunutin na. And the newborn's body is close to the mother's body. No agarako no ni ubing dapat nakadikit-met kadejay bagi ni nanang. Alright? So facing the breast, the neck is not flexed or not twisted. Ano pa? The newborn's whole body is supported by the hands of the mother. Okay, nakakasta dapat ni nanang. Okay, ano pa? Alaglagipan niyo pa yapo nga deti picture you correct latching on. Kitain niyo nga dejayan ti bibig di ubing, di yan ti lower lips na, they are flanged out. Kunada, nakakasta. Okay, kasi dati lower lip di ubing ti mangiduron, di gatas nga mangi pangato. Because always remember that there are tubercles of Montgomery, nagji paggapuan ti gatas below the on the lower part of the breast. Di nga pislen di ubing di using the lips, taano rumar di gatas. Alright? Ano pa, mas marami ka dapat nakikita na areola on the upper part kesa sa lower part. So naadado dapat, adada nga na amalan na radyo ubing ginakimbaba nga parte ti suso. That's how the correct latching on position is. Right. So that po yun, Dijay, proper mouth attachment, ibagbaga tatayan. The mouth of the baby should always be wide open during breastfeeding. Hanga dapat nga kasto lang ti pinagkunot na di ubing. Dapat wide open. Nakanganga nga permi, inamalan na nga permi dayjay. Nipples. Ano pa? The lower lip should be turned outwards or flanged out. Yung kunada nakakasta. Okay? The lower lip ni newborn. Aside from that, the baby's chin should be touching the breast. Okay, deto'y timid na dapat nakasidag ka di suso ni nanang. And the sucking motion should be slow, it should be deep, and with some pauses. Api nga masapol nga ag-pause di ubing, agtilmon. Kunana, okay, slow and deep na uunig dapat di pinagpunot nang no. Agpunot di ubing nga kunan lang apo haan nga usus today nga latching on. Right? Hanga naka-attach nga na siya at di ubing. Kas lamit lang data charger. Di ba na mo nga naidugsul nga na siya at di charger ka di cellphone mo ke awanti magna nga kuryente wenohan na buntug nga ag-charge. So that is the same with your proper attachment during breastfeeding. Aside from that, remember na maganda po na we promote proper attachment during breastfeeding because it prevents occurrence of colic. Pag sinabi po nating colic, it is abdominal distension which is caused by swallowed air. Gapo-apo ta, no napangit ti attachment na, pagkungkunot ti ubing, nga ti mapasamak is makatilmunso na ti angin. Gapo dayjay nga madinga attachment na from the nipple or from the breast. Dayjay nga pinakatilmun na ti angin, mapunnon tumitten ti angin dayjay tiyanan, anginen tun. Ang English po ng dayjay anginen is called colic or kabag naman in Tagalog. So no pitikem dayjay ti chan dayjay ubing kasla drum. Okay, that's what we call adventitious sound. Napunno aminen aputi angin dayjay tiyanan so nga nasakit dayjay. So that is what we call proper attachment. So makita yun nakadakkel di nga ubing, di ba? Dakkel di baba di ubing, dayjay chin na nakadeket ka dayjay breast ni mother. That's what we call proper mouth attachment. All right. Now after breastfeeding, you always have to do burping. Okay? Pag tag-aben nyo di ubing. Apay. Kasi hindi po maiiwasan na makakaswallow pa rin siya ng air. So, the baby should be burped to expel swallowed air because always remember po na milk is also gas-forming. It is a substance that when it is digested in the body, nagproproduce po ng gas yan. Alright? So, nag-tag-ab ka pa uminom ka kanuti, gatas. So what can you do is you have to burp the baby after feeding. So kasanuting ubrain detoy. The baby is positioned, resting on the shoulder. So kitain nyo da ubing ne, di yan ti abaga ni nanang. Okay, nakapatay di ulo na. And then you also have to give light back tapping on the back of the newborn. So pikpikan nyo medyo likod na. And it should be done 15 to 20 minutes after feeding. DJ apo ti kapintasan nga time nga pinagpa-burp tayo DJ ubing. Hami nga kalkalpas nga nagsusuki apo pinag-burp mo kung kunam pikpika mo agsarwa DJ yan So iyuray mo pa yung agsamay DJ tinilmun na nga gatas. So you should wait for 15 to 20 minutes after feeding and then you position the baby for burping. So by positioning them on their shoulder, on your shoulder, kunakuma, and then giving them light back tapping. So that's what we call burping. Next, breastfeeding initiation. Ang pinakamaganda pong ginagawa natin is we have to look for a quiet place. No irugi tayo ti agpasuso or irugi ni nanang tigpasuso, make sure that you take them to a place with less distraction. Okay, quiet place po dapat. Especially pag first-time mothers, ito po yung pinakamahirap, yung i-establish po ninyo yung first time na breastfeeding. So you have to place them on a quiet place para makapag-concentrate both mother and the newborn. Next, you have to find the most relaxed position for the mother. Kaya natigidda, kaya natigtugaw, kaya natigtader, ano yung position niya pinaka-comfortable niya before you start breastfeeding initiation. Next, you also provide proper back support to both mother and the child. Okay? Make sure nga medyo ubingket na supportaan nga na siya at jilikod na. And make sure nga ni mother ket hanga kakaasing agbagkat ti ubing by giving them back support. So misis agsanggir ka kadeto ini natugaw kunayo. Alright? Next, You also support the feet of the baby para hindi siya nagdadangle kasi nohan yung suportaran di sa kajubing ag danggel to suna di giant ag bitin. Okay? And also do not scissor hold the breast to prevent the blockage of the lactiferous ducts or lactiferous tubules or tubercles of Montgomery. Okay? So kasan ti pamayan tayo detoy? Di scissor hold nga kunada kay kastoy no dito kung magisuso makita dami lang. No dito kung magisuso scissor hold kunada di kastada na ikastada di jay suso. Hindi po ganyan yung dapat na ginagawa pag i-initiate ng breastfeeding. Kasi pag ginaganito mo to, you're blocking the lactiferous ducts which are located on the bottom part of the breast. No, ikaskastoy mo. Hanga makunot deje ubing deje. So what can you do is you can raise the breast here. Guyudan nyo ditoy. When ani, durun you from the bottom. Okay? When no, inapimpinas ni guyud na deje ngaton. So that's what we call scissor holding deje ikastada. Scissor hold. Nagets po ba? Alright. Next, we have to study the different holds that are available po for the newborn and the mother. Okay? Ito po yung cradle hold na tinatawag natin. The cradle hold is the classic breastfeeding hold. If the baby nursing on the right breast should be supported using the elbow of the right hand. So imagine deto'y kumadidyo ubing, agsusususunod dito, deto'y ulo na. Okay? Right breast, timang support dapat di ulo na is the elbow of the right hand. Maget, so ikas dyo, deto'y ulo di ubing. Cradle position. Deto'y normal apo nga uso sa renta nga suso. Alright? So the head of the newborn should rest on the right crook of the right arm nga pagpapasusman na nga right breast. Okay? Now, this is best for term babies, nagigidadakkelen, okay? Gusto ti sukat na, titimbang na, which are delivered via NSD. Pinakamaganda po itong cradle hold na to. As you can see on the picture, nadaras lang, di ba? Igamamidjay, sang mo di mesang imam, suportaran metenjay, sa kana. That's what we call the cradle hold. We also have the cross cradle hold. Yung cross cradle hold naman po, it is also known as your crossover hold. Okay? If the baby is nursing on the right breast, dito ti pagsuswan na, di ka di, and then dito ulo na. Use your left arm, left hand, to support the baby's head, and then di met mesa nga imam, di right hand mo, it should be holding the lower extremity. Makita yung met kadeta picture. Again, imagine nyo nga dito yung mic, dito yung ulo yung ubing. Cradle hold, kunata yun, dito yung nang agsususo, ipangko yung imak ditoy, and then dito yung mesa nga imak, igama dito sa kana. This is what you call the cradle hold. Cross cradle hold met apo, no dito yung ulo yung ubing, agsuso ka dito yung suso, dito yung left nga imam ti usarem. Right? So, kastamet ti cross cradle hold. Okay. Nunya ti pagsuswan na, di bangir nga imati, mang subsuporta jay, ulo. Kasta ti tsura na ti cross cradle hold. So, sir, para kanino po ito maganda? This kind of position or hold is best for babies who are small. Especially dagiti preterm, kada dagiti small for gestational age nga kunada, dagiti babasit, pinakamaganda po yun. So, kaya lang asing single-handed ni nanang, nga kasi babasit da. Okay? And for infants who have trouble latching on. Alright? Taano? Deje mesa nga ima ni nanang, mabalin nga iso ti manggayad ka deje suso na kasi deto iti makanawidan na. Di ka di? Alright. So that's what we call the cross cradle hold. Cradle hold niya kunada, so deto iti ulo deje ubing, deto iti pagsuswan na nga suso, right? Okay? Deto met dapat nga elbow ti mang support. Ito yung ulo yung ubing niya. Susod ito'y. Dito'y dapat timang support. At itsura na makita yo.
Dayimet cross cradle hold nga kunatayo.
No, dito'y ti suso nga pagsuswan na, dito'y yung ulo yung ubing, deji bangir nga imam timang suporta yung ulo na. Alright? So, nagsusod yung ubing, deji right pagsuswan na, yung left nga imam ti pag igamam, pagigam mo ulo na, and then they kumesa ti pagigam jay saka. That's what we call the cross cradle hold. Nakuha po ba? Alright? Ang next pong position natin is what we call the football hold or the underarm hold. Dito po, the baby is tucked under the armpits like a handbag or a football. Kaya po siya tinawag na football hold or underarm hold. Kasi basically, dito'y kilikiliti mangigyam ka di ubing. Okay? This is best for cesarean section mothers. Apay, tagamin di ba dagi cesarean section kita dati sugat dito'y tsanda. Alright? No dati sugat da dito'y, no kastoy da ngagigem, nasakit masagid dejay, sugat da. Cross cradle man when no cradle hold, matandagan lat da ubing dejay, sugat. So hindi po maganda yon cross cradle and cradle hold for cesarean section mother. Ang pinakamaganda po ay football or underarm hold because it avoids the pressure on the incision area. It is also best for babies who have trouble latching on because the hold allows the woman to readjust the breast. Okay? Ano pa, maganda po din ito for women with very large breast. Lalo nung nagdadakil ti suso ng babae. Diba? Apo, handa nga ma, arakop nga na siya at siya anak da at aglulupyas met ti suso da kinadakil nan. Okay? Narigat para kanya da dayjay. So pinakamaganda po sa kanila ay football hold or your underarm hold. It is also best for twins kasi nagpasuso ni nanang mapaggidan na nga pasuswen. Dagi anak na kasi nunya tigsususo nga agsususo nga parte nga suso isumit ni mga suporta jay ima. I will show you. Okay, baring makita yung may ilangan na siya at. Dito yung ulo ti ubing agsususo na ka dito yung right nga suso. Dito di yung right nga ima. So what do? You place the head of the newborn here. Right? And then the newborn is placed on the breast and then iyipit yo de jayanti saka na in your underarm. Sayo isupport de jay ulo na. Magets? Ganyan po yung itsura ng underarm or football hold. So nga kasla pagigigim di football nga makikita yung dagi sinan itlog ti bola ng color brown, parang ganun yung itsura. So marunong nga topic tayo is your side-lying position. Itong side-lying position, sobrang dali lang to. Amuyo amin deto yan no kasanong ubrain. In your side-lying position, it is also known as the reclining position. Both the mother and the newborn are lying in bed, duwada nga nakaida, side-lying position, with pillows on their back. Maikan tipungan di likod ni nanang, maikan di pungan likod jubing, and then both of them will face each other. The baby's head is then cradled for support. So makita yung met niya ni mamang, supsuportaran na dayjay, ulo dayjay ubing. Api sir, sino dapat ang gumagawa nito? This is best for mothers who are recovering from cesarean section. Lalo dagijay nananang ko mga under the influence of anesthesia pa lang, maulo-ulo do pa lang, handa pa lang makabangon, handa pa lang makatugaw. They can already start breastfeeding by using the side-lying position. Okay? Ano pa? Mothers who have difficulty sitting down. Okay? Dagijay na CS nga rod. Or mothers who are breastfeeding at night. Okay? Nagpasusuda, trabrabi, handa man sa apulan ti bumangon. Apay, tagaminket, mabalindang ubrain the side-lying position. Okay? So very comfortable po. Now, kaya ko po itinuro itong mga bagay na ito sa inyo because you have to adapt to the different situations of the mother when you are taking care of them. Laglagipin nyo nga adadagijay positions that are best for CS, best for normal yung weight ng bata, best for mothers nga dakil susuna, basit susuna. So it's up to you as midwives to use this knowledge so that you can advise the parents on how to properly hold their newborns during breastfeeding. Okay? Taano na pleasant metlaing adiji experience nga pinagpasusuda, taano duble-dublen dan tulat ti agpa suso. It is our responsibility to be advocates for breastfeeding. All right. Now, sir, api nga nga pangririm deta advocate tayo ti breastfeeding. Api gami nga mabalinti, matempla nga gatas, kay ibagada sir nga, pampasirib detoy. Deji kabsat ko sir, ket nakpromil idi. Ket anya tinapasamak sir, kay ultimo sirib na tatatatagmaw yung yan. Just kidding. Idi siya kano ti ubing, I was fully I was breastfed until I was 1 year old. And then, naggatgatas na, siya tinggatangan da iti promil. So, makita yo, I'm multi-talented, charing. Ngayon mo susuri dyan, nagprom-promil na kano, ngayon di kabsat ko nga mesa, iso natin nag-breast milk until 4 years old. Can you imagine? Ingga na upat na tawin, nagsususunakin ni nanang ko. Yan na sunatatan, di Canada. Okay, so nga na siya atapo no, kasi dito braan nyo kasi adadan sa nga maka-abroad dagi jay ubing nga fully breastfed na mas successful da in life. So api nga ibagamit sa nga mas successful da in life kasi basically handa nga managsakit, awan unay ti allergies da, kadaglalok kesakit no when I am exposed to certain amounts of heat when no cold no nalamiis ko when no ultimo bara agsupot-supot na. I have allergies. Why? Mabalin nga because of the cow's milk that was given to me when I was still young. Kiniading ko ke hangagal allergies mga digis na Canada data. Tagamin awam met hamay agsupot-supot. Siya agsupot-supot na payno makakaanak ti ikan nga di na angri kada dagi pasayan. So again, I have so much allergies. And that is basically baka pwede probably because of the breast milk and the cow's milk that I also took when I was still an infant, when I was still a child. Okay. So again, it's good that we know the difference between the cow's milk and the breast milk para mas madali nating makonvince yung mga nanay po na dapat sila ay magpasusu gamit ang kanilang mga susu at hindi dapat yung mga natitimpla na gatas. Alright, so now we compared the breast milk from the cow's milk. When we look at the bacterial contamination, the breast milk kasi, it has none. Konti or wala pong bacteria doon sa breast milk. Apay. Kasi po yung breast milk, it's fresh. It comes out from the mother which is very fresh, so hanga contaminated so nati any bacteria. But in the cow's milk, syempre may bote data, kada may processed pay data, aduti pag naan nga ima, iso nga, there is bacterial contamination. So mabaling agtakti di ubing? Yes. Alright, next. Meron din po tayong tinatawag na anti-infective substance. Yung sinasabi nating anti-infective substance, these are components that are found in the milk which can prevent infection. Dito di bagbagatay tatay nga colostrum when no immunoglobulin. Di ba yung bagbagat tatay nga pampatangkin tikiret dejay. In the breast milk, there is a presence of immunoglobulin which is an anti-infective substance that prevents infection in the newborn. So maganda po yun. Tagamin at dati, immunoglobulin nga pampatangken tikired medyo ubing. But for the cow's milk, wala pong nakikitang anti-infective substances that are active. Meaning the cow's milk cannot protect the newborn from any disease. But the breast milk, since it has antibodies, it can protect the newborn from early childhood diseases. Alright. Meron din tayong tinatawag na chon. Yung chon po, that is the chemical symbol for protein. Alright? The protein that is present on the breast milk, o i-mark nyo to sa board exams ha, because it comes out in the board exams. Remember this. The protein that is found on the breast milk is called lactalbumin. The protein present in the cow's milk is what we call casein. Alright? So makita nyo, 1% lang yung protein na nakukuha ni baby sa breast milk, and then sa cow's milk naman po, 4%. Yes, sir, hangarod nga napimpintas, no? Adado ti protein nga ma-allergy baby? Hindi. Apay. This is the reason why the newborns who are breastfeeding ket napintas di takida. Formed isuna ngimhanga natangken. Because the protein that are present in the breast milk is just adequate. Sakto-sakto lang. Ngem, no aggatas suna kadagiji matempla, when kadagiji cow's milk, nagngato gamin ti protein content na. And because of the high levels of protein, yung bata po, nagkakaroon siya ng constipation. Isong agtabel, deje ubing. Isong napintas batig tabel, haan. Kasi mabaling nga magkaroon so na ti anal fissure or masugat dejay, puriit na. There will be lacerations on the anal sphincter because of the constipated stool. Okay, di impacted stool nga nakatangtangken, hangarumwar. So, napintas ba ti 4% nga protein? Hindi. Mas maganda pa rin yung lactalbumin, which is easily absorbed by the body, kasi yung protein na casein, which will cause constipation. Next, we also have amino acids, which are the building blocks of protein. In the breast milk, meron pong enough amino acids. But in the cow's milk, there is not enough amino acids or building blocks of protein. Next, sa fats po, pareho lang sila. Both of them have average of 4% fats. When you say fatty acids naman po, the breast milk, yung fat po naman nandoon sa fatty acids na, yung fatty acids po na nakakita natin sa breast milk is saturated. Saturated fats which are easy to digest. But in the cow's milk naman po, it's unsaturated fat, which is also very difficult to digest. Kita im sida kati nakakarkarne ken nakatabtaba, itamkit agtabel ka. Same principle with your cow's milk and breast milk. Next, we also have your lipase. Your lipase are enzymes that are best for metabolism because they help break down several components in the body for metabolism. Now, in the breast milk, adda apo ti lipase. So nga, nadardaras apo ti metabolism di ubing. Ngayon, for the cow's milk, there is none. Wala pong lipase doon. So meaning, mahihirapang mag-metabolize si newborn kasi wala siyang enzymes that are responsible for metabolism. Meron ding sodium. Alam niyo yung sodium? Deto'y ket pampaumbal. Okay, sodium. So, nga may parit aputi, agsi dati na aapgad, dagiti dati high blood na kadaglalok because sodium will increase the likelihood of edema, umbal. Okay? In sodium, when we talk about sodium in the breast milk, there is approximately 6.5 grams per deciliter basit. But when you compare it to the cow's milk, apo adaduti sodium na dayjay 25 grams per deciliter. So nga dagiti ubing agdedede using cow's milk or bottle milk, apiya kasi na naglulumig da kung kunayo. But that's not actually healthy kasi umumbal dagijay. Kasi nga meron silang sodium contents. Mataas yung sodium contents ng iniinom nila. Whereas in the breast milk, 6.5 grams per deciliter lang. So makita yung kadakkel na. You also have your chloride. Same lang. Almost half or more than half. 12 grams per deciliter for chloride in the breast milk and then 29 grams per deciliter in the cow's milk. So makita yun yung sodium ken chloride naggangato. Sodium chloride is asin. So napapgad ka no dayjay cow's milk which is bad for the newborn because it can lead to edema. Now, when we talk about iron contents, iron apo deta Fe. Okay, Fe means iron. When we talk about iron contents, may small amount lang ang breast milk, but it is well absorbed by the body. Okay? In the cow's milk naman po, meron bang iron? Yes, meron ding iron. It is small in amount, but it is poorly absorbed by the body. So judging on this chart alone, judging on this table alone, makikita natin po how good breast milk is compared to bottle milk or cow's milk. So kung nadangarod, ang gatas ng ina ay para dapat sa bata at ang gatas ng baka ay dapat para sa baka. So nga hindi po natin dapat pinapadede yung mga newborn ng gatas ng baka kasi hindi naman po sila baka. Alright? Next, we also talk about the care of the eyes. I think this is going to be my last discussion kasi we've been having this session for more than an hour already. Baka meron pa kayong gagawin. We have the care of the eyes or what we call eye prophylaxis. Ito pong eye prophylaxis na to, it is also known as your Creed's prophylaxis, and it was invented. It was invented in the year 1884. It's given to prevent gonorrheal conjunctivitis. The gonorrheal conjunctivitis coming from the word gonorrhea, which is a sexually transmitted disease. No, deji gamin causative agent mapantiyan ti mata, mabaling agkoso na ti blindness ka deji ubing. Okay? Always remember that infants who pass the birth canal, okay, may have their eyes contaminated coming from the discharges of the vagina, which will cause neonatal blindness or ophthalmia neonatorum. Okay? Apay kasano nga mapaspasamak detoy. Lagi penyo di gonorrhea is a sexually transmitted disease. STD suna wenno STI. Tatan, DJ mother nga dati gonorrhea na, there are discharges coming from the vagina apo, DJ pepe na, ada rumrumar nga discharges. These discharges, mabalin nga ano dagito yung rumrumar niya, they contain the causative agent at dati mikrobyo na DJ. Kano na yanak di ubing using the via vaginal delivery, mabalin nga dagito nga discharges mapanji matada, which will now cause blindness. Nagsastart siya as gonorrheal conjunctivitis, lumteg di matana, until lead to ophthalmia na yun natorum wenno agbulsek. Newborn blindness, tinagan na dijay. Alright? Now always remember that this blindness can be caused by two sexually transmitted diseases. Nice, gonorrhea and chlamydia. Duwa dijay apo. The causative agent for gonorrhea is Neisseria gonorrhoeae. And the causative agent for chlamydia is Chlamydia trachomatis. You underline that, you highlight that because that comes out in the board exams. Alright? Dagita apo ti mangkokos ti neonatal blindness, especially if they are born via normal spontaneous delivery. Now, hindi, ti ususarenda is silver nitrate. This is a chemical that they mix with water and then ipatagdadyan ti mata di ubing. But because of technology, hindi na po natin ginagamit yan. Ang ginagamit na po natin ngayon is what we call the drug of choice or DOC, which is oxytetracycline ophthalmic ointment. Alright? Now, datagamin silver nitrate, ilang mapatay na data is Neisseria gonorrhea. But your oxytetracycline ophthalmic ointment, it can also eliminate Chlamydia trachomatis. So anong mas magandang gamitin? Yung silver nitrate ba na isa lang yung napapatay or yung oxytetracycline ophthalmic ointment na dalawa yung napapatay ng causative agent? Malamang yung dalawa. Alright? So it's killing two birds with one stone or killing two STIs, causative agent with one ointment. Alright. So paano po siya nilalagay? The oxytetracycline ophthalmic ointment is applied on the lower conjunctiva. Dito'y apo ti pangipanan da dejay. Okay? So what do? Is we open the eyes of the newborn by applying pressure on the upper and lower eyelids. Ikasta tayo, bistraden tayo matada. And then the manner of giving the drug is from inner canthus to outer canthus. Dapat po hindi nagtatouch yung tip ng ointment, yung tube ng ointment, dapat hindi mo natatouch DJ yan ti mata na ubing. Kasi just in case nga infected DJ nga tubing at least nga mapanji yan ti mata ubing. Alright? So inner to outer canthus, ibukirad yung kasta and then you drop the ointment from inner to outer canthus, jibangir manen, ibukirad yo from inner to outer canthus of the eye. And then after that, nung naikabil yun, you close the eyes slowly to allow the ointment to spread. Agwaras to DJ. Now, nasa titsura na DJ agas, ceramycin or oxytetracycline ophthalmic ointment. Gawa yan ng Pfizer. Alright? Kasta apo ti pinangbukira diyo DJ yan ti matana. So makita yo ke merong fiery red yung mata ng bata. So nagsastart na po yung kanyang gonorrheal conjunctivitis. So makita yo ke aglablab bagad yung matanan.
Ladies and gentlemen, that ends our pre-recorded video lecture for the subject NCM 107, care of the mother, the child, and the adolescent. And I hope that you learned something about breastfeeding today in our session, and I hope that you also enjoyed our class. To check the attendance, please take a screenshot of this slide and upload it on your Facebook group chat as part of your attendance, but you will also have to write the full name of your favorite person inside of your classroom. So tag the person that you think is the most awesome in your section, and that will comprise your attendance. Again, please turn on your camera so that we can have our picture taking, and after the picture taking, you can just immediately leave our class para po hindi kayo mabidyohan. With that being said, maraming salamat for attending our session.